What is up, everyone? Welcome back to the channel. It's gonna be another week in the life log. I'm actually technically not on any rotations right now. I finished up with my ortho rotations and like research blocks a few weeks ago. So now I just kind of have some downtime between now and when my away rotations start. So what I wanted to sort of go over in this video is partially how I'm starting to prep for away rotations and also how I'm balancing that with the MBA that I'm doing. My school, since we're sort of accelerated early on, we have a pretty robust option to do a 3-year program, but everyone kind of does the same curriculum throughout all of your schooling. So that means people who choose to stay on for a 4th year, a lot of your graduation requirements are already done. So your 4th year is really just all what you want to do. People will just continue to take a lot of elective rotations. Some people will do a bunch of research, but there are also several like second degrees that our school offers in conjunction with other universities. So there's an MBA, an MPH, Masters of Engineering, a whole bunch of stuff. So I'm doing the MBA. I have been interested a little bit in business, like personal finance, over the past few years, and I think it's important for medical students to get educated on that kind of stuff because we go into a lot of debt to get this degree, and we really aren't taught anything about financial literacy throughout school. So because that, and there's no like extra sort of tuition or extra years added on to our education, I decided to go with it. Other schools will have you sort of take a year off between maybe like your 2nd and 3rd or 3rd and 4th years to do a second degree. And I don't really know how the tuition works. I would assume that you would have to pay like extra tuition to whatever school you're getting the degree through, but at least the way that our program works out, there's no extra tuition, so it's another bonus. I'll talk more specifics on the MBA later in the video, but today's Monday. I just got back from the gym and I'm going in to do a bunch of trauma cases today. The first one doesn't start till 11, so I had a little bit of time in the morning to get some stuff done, get a workout in. And there's a good variety of cases. The first one is actually a pediatric patient who had a mid-shaft femur fracture, unfortunately. So we're gonna go in, probably put a nail down their femur. I think we're gonna be operating with one of the pediatric orthopedic surgeons, so that'll be cool. Then the next one is a scapular fracture. Most scapular fractures are actually managed non-operatively. However, the reason we have to go to the OR for this one is it actually extends into the glenoid, so the part of the scapula or shoulder blade that forms your shoulder joint. So if that's disrupted, that can cause a lot of issues. So I need to go put it back in place, put a plate over it. And then the last one is just an ankle fracture, but I've never seen one of those, so I'm excited to see kind of like bread and butter ortho trauma case. All right, what's up? So it is Tuesday. I just got back from the OR, spent another full day with hand surgery. It's probably going to be my last time operating with that surgeon before I leave for away. It's just because he only operates at that surgery center like every other week. But it was a good day. Lots of sort of bread and butter hand procedures. We did probably like half of our cases were carpal tunnels, so got a lot of experience with that. Did a ganglion cyst, a cubital tunnel, and then some more interesting procedures. We did a digital nerve repair, so a patient got a laceration on their sort of palmar side of their index finger. At first, they thought it was just no big deal, just put a Band-Aid on it, whatever. But then over a few weeks, they started to develop like numbness and tingling and pain in that area. So we went in. The injury was honestly very small, wasn't like a complete transection of the nerve. So the doctor just put what's called a conduit around it. It's kind of just this tube that helps protect the nerve as it grows back together. And then he put like 1 or 2 stitches in it. That was crazy because it's the finest suture I have ever seen before. It's a 9-0, which if you know anything about sutures, the sizing scale, when you're talking about O's, goes smaller as the number gets bigger. So like a 1-0 is a thicker suture than 2-0, 3-0, whatever. And like sort of a normal suture size to use when closing skin or closing like subcutaneous tissue is usually like a 2-0 or a 3-0. In hand, a lot of times we'll close the skin with like a 5-0. but this was a 9.0, so definitely like the finest suture I've ever seen before. And I could barely see it with my naked eyes. The surgeon had loops on, which magnify everything, but it definitely looked like finer than a strand of hair. So that was just crazy to see him working with that. And then another cool case we did was a radial head repair. So this patient had a fracture of their proximal radius that was just treated non-operatively, but it unfortunately didn't heal properly. So they're having a lot of pain and loss of range of motion. So we went in, basically cut off the proximal part of the radius and just replaced it with metal. Very similar to like a knee or hip replacement. So definitely not the most common procedure. So it was nice to see some variety. It's kind of it for right now. I'm probably not going to go into the OR for another few days just because the doctors I usually work with aren't really operating until Friday. So it'll just kind of be a lot of MBA work right now and studying for the test I have in a few days. All right, it is Thursday, and I want to go over sort of more details of the MBA. I took the exam yesterday. Wasn't too bad. It was in international perspective, so it was like sort of an entry-level international business course. Yeah, it really wasn't that bad. It was like 60 multiple choice and then 2 like short answer. So pretty manageable. I'm currently in 3 MBA classes. It actually started back in March where there was several like pre-qualifier classes where you needed to have taken basic level like accounting, marketing, finance, math, and statistics, I think, within the last 5 years. And I wasn't a business major, didn't take any business classes, so I wouldn't have qualified for any of those like accounting, finance, marketing things anyway. But even like the math and statistics, it's been more than 5 years since I took that in college. Thankfully, as being a medical student, we are exempt from having to do that stats requirement just because we get a lot of stats and epidemiology in med school. But from like March and April, I had 4 pre-qualifier classes that were just pass-fail. They were all like self-guided. You could do them in one day if you wanted to. And then now we're in the actual like core classes, which I think there's like 10 or 11 of them. It's recommended that you finish them like before the end of the year. So it is definitely like an accelerated program, just because it's all in kind of a year, maybe like a little bit less than a year, especially with these core classes. So that kind of makes it really difficult when trying to schedule aways because aways are usually insanely busy. Another way to refer to aways is a sub-internship, which means you're an acting intern, like you're supposed to be doing sort of the same things and working the same amount of hours as an intern, which is 80 hours a week. So it's not really conducive to also doing an MBA on top of that. So because of that, I'm taking advantage of this sort of span between my actual home rotations and starting aways. And I'm doing 3 classes that I should be able to finish pretty much all of them before my away starts. There might be like one exam that I have to take like the first week of my away just because it doesn't open up. But other than that, like I'm knocking these 3 classes out. Then during the summer, I'm only really taking 2 courses. I think I'm going to be in an accounting course, and then maybe like a legal studies course. So while it's still not ideal to be taking these courses during aways, just because the focus is obviously on like my clinical responsibilities because I am in medical school, not, business school. But I feel like just taking 1 course at a time during these aways is going to be manageable just because there will be weekends where I either have like both the days off or at least one of the days, and then I'll just really have to grind the MBA those days. I've spoken with students who have done a lot of aways and successfully completed the MBA in sort of like these high demand, like high hour surgical subspecialties. So I know it's possible. It's just going to be a grind during those aways. And then I'm sort of backloading a lot of the other courses to take once my aways are over. So that's kind of how I've been balancing it. I'm just trying to get as many classes in before and after aways and then just taking the minimum amount. So I'm still able to, complete the MBA in 1 year. but making sure that my workload is sort of as low as possible MBA wise, just because I know clinically I'm going to be working a ton. Alright, so it is now Friday. I just got back from the OR. It was a pretty short day. There's only one trauma case that came in. It was pretty interesting. It was a sort of mid-shaft femur fracture in someone who already had a hip fracture. So they already had some hardware in sort of like the top of their femur. So that kind of limited our treatment options. Usually, kind of any sort of femur fracture, hip fracture, whatever, you do what's called a femoral nail. So just kind of a piece of metal that goes down the femur, and then there's a component that goes up like the femoral head to also secure it that way. So that was what the patient was treated with initially for their hip fracture a few years ago. Usually those sort of fractures are just treated with a short nail. So it ended a few inches from where they got their subsequent fracture this time. So because there was already that hardware in there, yes, I guess we could have removed it and then put in a long nail, which is sort of the same thing. It's just longer and goes pretty much all the way to their knee. That would definitely be an appropriate treatment for this. But since they already had that in there and the patient was sort of older and not the most healthy, we wanted to do something that was going to be simpler, quicker, less surgery, just so it wasn't as taxing on the patient's body. So instead of doing a nail, we plated it. So we went in laterally, we got it reduced, put a plate on that stretched pretty much from their knee all the way up above sort of the end of their short nail, and then just put in a bunch of screws and called it a day. It was only like an hour and a half, so really not that bad. Now I'm just doing some more MBA work for the rest of the day, trying to just really stay on top of stuff so I can finish everything that I can before waves start, just because I'm going to be so much more busy and I'm going to have very limited free time to work on MBA stuff. So while I have sort of this downtime right now, I just want to get ahead on everything. So I'm saving myself some stress down the road. All right, well, that is going to do it for today's video. If you enjoyed, please be sure to leave a like below and subscribe if you want to see videos like this in the future. Thanks, and I'll see you in the next one.